Morgan, cardiologist and the executive director for health and community education at Piedmont Healthcare in Atlanta. She joins us now. Thank you so much
It's a
for
pleasure.
being here. We always
Absolutely.
love picking your brain. So what is all this buzz about flirt variants? How concerned should we be?
Yeah, we've got these new variants that are out there, and they are taking over about 32.5% of the cases that we have. So one of them is 25%, the other in this KP family is 7.5%. They seem to have the same symptoms, but they are overtaking the previous variant, JN1, so probably have a little bit better ability to evade immunity and to be a little bit stronger, a little bit more contagious. And so we're keeping an eye on it.
And they're part of the Omicron family, right?
This is still the Omicron family.
Won't
It's
go away.
unbelievable, right? We are still in Omicron.
Yeah. And how much protection should we expect to get if we're up to date on our
Right.
vaccinations?
And so that's what we're trying to figure out. And that committee, the advisory committee, will meet in June to try to determine what needs to be covered for the fall vaccines, but also if you have had your vaccine within the last 3 or 4 months or recently been infected, kind of the same types of recommendations, you are probably in really good shape. And as a society, we've got pretty good immunity. We're not naive to this virus any longer, our bodies. But we'll see kind of what happens, because as our immunity builds up, we tend to push the virus more into the fall and winter months, as we've seen these summer surges, now fall and winter, where it can really take hold and kind of join its brothers and sisters, the other types of viruses that we see flourish in the winter.
And some improvements to be done in terms of the vaccination rate. Did I see that right, in the 20%?
Well, a lot of improvement can be done. We're
Yeah.
pretty low, right? We're below 25%, so we have a long way to go. So tons of improvement, but hopefully there will be better adoption as we move forward, because these viruses continue to evolve in the Omicron family, large and prolific, and we really don't know at what point that it might shift.
Let me shift gears right now into bird flu. A lot of people have been talking about this. They're worried about this. What's the deal? What has happened with cows that wasn't on anyone's radar? We knew about, chickens, we knew about pigs, but now we're seeing it in cows. Why has that concerned public health experts?
It's concerning because it's another level of evolution. Generally, this is in birds, and birds pass it amongst one another. Now we're seeing it in cows, so the cows are contracting it from the birds, but what we're seeing in all of these herds is that the cows are passing it from one to another. So it's gone to the next evolutionary stage, and after that is humans. And we already see one case where cows have passed it to humans.
In Texas.
In Texas. And we don't want to see human to human transmission. What's interesting about cattle is that the receptors for this bird flu, the cows have both the bird receptors and the human receptors. So they are a very interesting reservoir that are bridging birds to humans. So we're keeping a really close eye on it. We really don't want it to get into humans and then have the ability for human to
If they get
transmission.
human flu and bird flu, mix it together, that's an issue. Well, it would be remiss of me not to ask a cardiologist about this Wegovy news, this long-term study put out by Novo Nordisk about semaglutide Wegovy, showing some pretty stunning health benefits. What were the key takeaways here?
Key takeaways is we're looking at patients with heart disease and obesity, but without diabetes. Remember, these GLP-1s have been developed for diabetes. So all the initial studies were in obesity, heart disease, and diabetes. So now we see it without diabetes, and we still see these heart benefits. And that study was done specifically with Wegovy. Previously, the earlier studies were done with Ozempic. So there seems to be cardiac benefit, even in patients who are not losing weight, still cardiac benefits from these drugs. So it remains to be seen. And remember, Wegovy is given at a larger dose than Ozempic. So it could be a dose effect. These are really still the same molecules.
And so much to talk about there, but not enough time. Dr. Jane Morgan, thank you so much. We'll be right back.